Okay, so let's begin just a little bit of arriving to where we are currently in the present moment. So first, it's nice to take a position that helps facilitate that. And I like to place both my feet on the ground. And we can move our hips to the back of the chair, if that's comfortable for you. And I like to kind of wiggle my spine just a little left or right, nice and straight, nothing painful. And we can raise our shoulders up to our ears and then just pull them back. So we have a nice kind of upright chest, and head is midline, neutral, chin maybe a little tucked, hands in whatever position's comfortable for you. And you can have your eyes open or closed, whatever feels good. If they are open, just kind of lightly gazing at the edge of the desk or at your knees. But not really gazing around the room or getting a lot of visual stimuli. And then whenever you're ready and it feels good for you, let's take 3 nice, long, deep breaths at your own pace. And then just allowing your breathing pattern to take its normal, usual thing, not having to control it or make it be a certain way, just trusting that the body will breathe, and that's what it does. And first, let's bring our attention to the thoughts. What kind of thoughts are happening for you at this time? Just seeing if you can kind of watch the thoughts like a TV screen. So when thoughts happen, we're not trying to alter them or change them or have them be a different way. Just seeing if we can kind of watch them pass through. Just what thoughts are occurring for you right now. Maybe you're thinking a lot of thoughts, or maybe it's difficult to even find a thought. Either way, that's fine. Just seeing what thoughts are there, simply observing, maybe curiously exploring like a child. What's going on in the mind for you right now? And then taking a nice deep breath. Let's bring attention to sound, the sensation of hearing. So sounds inside the room, sounds outside the room, maybe even inside the body. Just offering attention to the sensation of hearing. And noticing the beginning of the sound, the end of a sound, and any space in between. And if the mind wanders and starts to plan or reflect or ruminate on some topic, that's fine. We know that's normal. It's to be expected. That's what the mind does. And when we notice that, we just acknowledge and then gently escort our attention back to the present object. And right now, that's the sensation of hearing. Sensation of hearing. And you just do that as many times as you need to. And then taking a nice big deep breath. Let's offer some attention to the felt sensation or the body. And just doing a quick scan and seeing if there's any strong sensations occurring in the body for you right now. Or maybe just seeing what it's like to sit, the sensation of sitting and feeling supported by the chair. or temperature on the skin, or anything that calls to your attention. And maybe you feel no sensation at all, and that's okay too. Just checking in. And then let's offer some attention to the sensation of breathing. If you like, you can place your hand on your chest or your belly. And just noticing the changing sensations of inhalation and exhalation. And maybe what the beginning of inhalation is and the end of inhalation, the beginning of exhalation and the end of exhalation. And noticing if there's any pauses or spaces in between. And then taking a nice deep breath. And let's begin a quick muscle relaxation scan together. So we'll start at the top of the head and just seeing if it's possible to imagine or actually rest and relax the muscles at the top of the head. Scanning through to the forehead, the eyebrows, the eyes, and the temples, allowing the eyes to soften. And into the nose, the cheeks, the jaw, allowing the jaw to maybe rest open, the tongue, to the ears, back of the head, scanning through to the sides of the neck, the back of the neck, and the front of the neck. Seeing if the throat can soften. Scanning through to the shoulders, an area where we hold a lot of tension, seeing if it's possible to relax those muscles, letting them disengage. Scanning through to the upper arms, biceps and triceps, elbows, forearms, hands, fingers, allowing the upper extremities to become heavy and rest. To the upper chest, into the ribs, upper part of the abdomen, middle belly, lower belly, maybe imagining all the inside organs resting. And back up to the upper back, scanning through to all the muscles on the side of the spine, seeing if it's possible to have them relax as you scan through. And into the middle back, lower back, continuing through to the sit bones, into the pelvis, into the thighs, back of the thighs, hamstrings, quads, knees, and the calves, and the shins, ankles, feet, top of the feet, bottom, and the toes. Just taking a moment to note that this is an opportunity or potential for rest. At this very second, there's nothing due. Like right now, you don't have to actually do anything. There's no physical harm. And that at this moment, there's a great potential for resting. And then taking a nice deep breath. And checking in with your intention for your day. What kind of a day or afternoon or evening would you like to have? And what can you do to help facilitate that? Maybe something as simple as you'd like to study well, so I will have a nice meal, take care of my physiological needs. It can be real simple, just checking in. And then taking a moment to offer some words of encouragement, all the hard work you've been doing. It's okay to tell yourself that you're doing a good job and the best that you can. So just take a moment to offer some words of kindness to yourself, whatever you may need to hear right now. Take 2 more nice big deep breaths at your own pace. And then you can start to wiggle your toes and your fingers. You can open your palms, extend and flex your arms and legs. And let's just roll our head a little bit to the right ear to the right shoulder. Just kind of stretch that. You can open your eyes whenever. And left ear to the left shoulder. And then just little half circles for your neck. And then you can roll your shoulders a few times forwards. And then a few times backwards. And then go ahead and stretch on up to the ceiling if that's comfortable for you. And then just tell yourself good job for participating in a health promotion activity. So, okay. Thank you. Well done.
Thank you.